In an effort to effectively combat various types of cancer in Nigeria, 6 First Ladies under the non-profit foundation First Ladies Against Cancer have donated cash and other gifts to some cancer patients at the University of Abuja Teaching Hospital. Kebbi State First Lady Zainab Bagudu says the foundation had planned to support 5 patients originally, but raised the bar to 10 when they witnessed the plight of cancer patients at the hospital ward. Other First Ladies also called on relevant stakeholders to support cancer patients. Well, the First Ladies present are Eunice Autumn of Benue State, Bamidele Abiodun of Ogun State, BC Fayemi of Ekiti State, Lami Fintiri of Adamawa State, and Olufunke Abdurazak of Kwara State.
Indeed, cancer is a problem in low middle-income countries, and for this reason, and also the fact that it's a very expensive condition to treat and not easily diagnosed. So for these reasons, we feel that at a level we have a platform that will well serve the patients. We hope that by speaking to you and by carrying out this visit and supporting them, we'll be able to get more Nigerians and even beyond to focus on the issue of cancer. Initially, we had planned to support 5 patients, but on getting here, we realized that there were a lot more, and so we've increased that number to 10 patients for the main plan. And then, of course, we support all those on the ward in token as well, so that we don't just walk in and leave the others like that.
And the issue of cancer is something that is a common denominator, particularly amongst women of all social, economic backgrounds. So it's a pleasure to be a part of this network. Not all governors-wise are members of FLAC, it's not some of us. But we are really pleased with what we've been able to accomplish. And we would like to assure the hospital that we'll continue to be partners. And also, wherever you can, please let your colleagues know in the hospitals in different parts of the country that we are willing to work with them, and will continue to use our platform to advance this cause and to be advocates for all those who experience this illness.
We have done all that is humanly possible to ensure that our patients get the best that can be available within the country. As we all know, government alone cannot do everything, and therefore, once we have partners like the First Ladies Against Cancer coming to bring succor to patients, not just patients, but cancer patients, I think we are highly indebted to the initiative and to the group. So please just once again appreciate that.
Well, we are now being joined by the First Lady of Kebbi State, Zainab Bagudu. Thank you, First Lady, for joining us on the news tonight. And well done for what you've done so far. But let me begin by asking you, cancer is a leading health problem around the world, and Nigeria is not isolated. Some statistics will say about 72,000 cancer deaths are reported or recorded annually in Nigeria, with about 102,000 cases. So for a listener, for a Nigerian who is watching the news tonight and says that the First Ladies of 6 states went to a hospital ward and helped 5 patients, how do you respond to that?
Well, it's 10, not 5, and we must understand that these numbers occur all through the country. On the ward, when we went today, we were able to assist all the patients we saw, including pediatric patients. Those were the numbers of patients on the ward. And one of the reasons why you don't find those 72,000 in the hospital and we have over 100,000 deaths is because there is no awareness. They're visiting the traditional clinics, they're visiting the religious homes, they're going there to seek help for their conditions as opposed to coming to the hospital. This is why there are various initiatives, including that of FLAC, including those by the federal government, including those by state governments, to assist the patients in treatment, to assist the general population in screening and diagnosis, and most of all, to increase awareness about the condition. So it is our hope that if we continue to encourage patients all over the country, by such gestures as the one that was done today. It is a gesture. It is not sponsored by anybody. We tax ourselves to try to bring this assistance to them. So I hope that it will be appreciated, and there's more to be done. It's not the first time. Actually, the ward that we went to in the University Teaching Hospital Abuja today was refurbished totally by FLAC about 3 years ago. So it's a continuous exercise and one that we intend to fully continue.
Very brilliant. And when you think about the numbers, Madam First Lady, 102,000 new cases recorded every year. The issue of funding, I mean, you just said you have been self-funding so far. How are you overcoming that particular challenge? Are you into some kind of partnership with private sector? How important is the private sector buy-in into what you're doing? And your advocacy, is it in any way helping, directing the states and even the federal government to come up with policies that can, alleviate the sufferings of those who unfortunately face cancer?
There are a lot of questions bundled in there, but I'll try. I chair the First Ladies Against Cancer of Nigeria, and I also sit on the board of the Union for International Cancer Control. I have been nominated to stand or shortlisted as the president-elect. So I think that these are all very high-level positions and platforms that enables us to fulfill one of the aims of our association, which is high-level advocacy. In Nigeria as a country, there have been various government initiatives which we have been directly and indirectly involved in. The federal government has currently running a cancer health fund. The 2021 budget appropriated the amount of over 700 million naira, which 2020, over 700 million naira was appropriated, and that distribution has just started. The amount for 2021 is much less because this was a new program, but we were directly involved in advocating for these funds to be given to cancer patients so that cancer patients can directly receive treatment from 8 selected teaching hospitals across the country for them to be able to ease their care. There are also state government initiatives. For instance, in Kebbi State, we have an indigent cancer fund, which the state government has funded to the tune of over 80 million naira to date, and about 160 patients have benefited. One of the things we must realize is that cancer is very expensive to treat, to diagnose, and to even live with, both for the patient and for the family. It can bankrupt even middle-income or middle-class people. Policies, the Indigent Fund has been accessed by people, and then we work in partnership with pharmaceutical organizations. In the Medicaid Cancer Foundation, which I founded, we have various partnerships with pharmaceuticals such as Roche, Pfizer, AstraZeneca, the manufacturers of this cancer drug. Our aim is to reduce the cost of cancer treatment. It was done with HIV, and it's our hope that we'll be able to do it with cancer as well. On the global level, I work with the UICC that has just initiated a new program called ATOM, Access to Oncology Medication, which is basically the same thing, reducing the cost of cancer treatment so that we can ease the plight of patients. There are a lot of initiatives. We also have the chemotherapy access program that is run by the Federal Ministry of Health, whereby drugs are distributed to teaching hospitals and the patients can access them at a reduced rate. We work with the National Health Insurance Policy to ensure that cancer diagnosis, treatment, surgery is included in basic programs, basic packages of the health insurance. And this has been quite successful. Of late, there has been a new insurance bill, and this covers cancer patients more extensively than it has ever been done in the past. So we're moving the needle on the clock. It's not as fantastic as obviously the high income countries, but what we can do, we're making sure that we use our loud voices collectively to get done to the benefits of the patients.
Indeed, it's about getting creative with the funding, because treatment of cancer is not only psychological, it's also financial burden for those affected. Madam First Lady, let me ask you, because you said something in your previous response. You talked about awareness of cancer, and I know, I dare say that you have been championing this cause for a very long time when it comes to cancer. How do you feel, and where would you say we are as a country when it comes to cancer awareness? And what are some of the prevailing misconceptions you have heard about the disease cancer?
Well, the awareness is not good. I cannot put a figure to it because we don't even know what is going on in the rural areas where the majority of our population lives. But the awareness, for instance, if I use my own experience in the States, and like you said, it's something that we have been working on for a very long time. And so in Kebbi, one of the most diseases that you hear commonly spoken about is cancer. Even at that, the numbers of patients that we see in late stages is a lot and quite disappointing, which is why we focus on awareness. It is a very low-hanging fruit, such that if our people know the early signs and symptoms, and most importantly, they seek the right type of care, as opposed to going to orthodox medication and faith healing, we will see better results. If we diagnose it in stage 1 and 2, we're likely to have closer figures to those of the United States, where about 95% have a 5-year survival rate. On the flip side, for us in a country like Nigeria, and indeed other low middle income countries in Africa and beyond, this 5-year survival rate is closer to 20%. So this is a great worry for us. Pediatric cancers is another one that I must mention. Most pediatric cancers can be cured, in particular leukemias and lymphomas, but only if they are diagnosed early. The medication exists, all the tools that we need exist, but we do not get them early. We saw some on the ward today in Gwago, in the teaching hospital of Abuja. Unfortunately, many of them, out of the 4 that we saw, 3 of them were late stages, and the medications are there, even though some of them are receiving the chemotherapy, but unfortunately they have come at a later stage where they have bone metastasis. So there are lots of things that can be done to increase awareness, and we have a lot of civil society that are increasingly working in the cancer space to see that this is being done. We hear a lot of misconceptions. It's a gene, it's a curse, it's due to some things that you did in your past, and so on. Cervical cancer, which is a cancer that the WHO has earmarked to be eliminated by the year 2030, using tools, simple tools that are available to us today, such as early screening, their targets, vaccination, and early treatment. Unfortunately, in Nigeria, we do not have a national screening program. We do not have vaccination routinely for our girls for HPV virus, which is the known cause of cervical cancer. And of course, like I said, treatment comes late, although the tools to use for this treatment are very easily available and quite cheap to obtain. The technology is there, but what is lacking is the awareness. So we hope that by talking more about it, we'll be able to get to where we want to be.
Okay, thank you so much, and thank you so much for your work. Hajia Zainab Bagudu, the First Lady of Kebbi State, thank you so much for joining us on News 99.